I mean, the feeling in the pit of your stomach cannot be described. I mean, when they called me, they said, "You need to sit down. We have something to tell you, and it's bad." I'm Deb Van Haften. I'm the Executive Director of Pharmacy in the Edmonton Zone for Alberta Health Services. Pharmacy prides itself on accuracy. It's one of our cornerstones of our profession, so that makes it very difficult then to accept this. TPN stands for Total Parenteral Nutrition. It is essentially food or nutrition that is provided for babies and for adults when they're unable to eat. I was notified that there had been an error in our preparation. One of the components that goes into TPN is called trace elements. We mix them together in specific proportions, and then that end product is added into the TPN. What had happened was we'd made a calculation error. In essence, we made those trace elements too strong and didn't realize it.
My name is David Mador. I am Vice President with Alberta Health Services and Medical Director for Northern Alberta. My initial reaction was that I was scared, that I was very scared.
At that time, we were, I would say, shell-shocked.
I didn't know the details. I didn't know the potential harm that had come to our babies. People, in a circumstance like that, they just put everything aside and they just get on board, and we did a ton of work in a very short period of time. Particularly the first 3 or 4 days when we were identifying the patients, identifying the nature of the problem, doing the lit review, getting the charts reviewed, a ton of work.
Because that was the issue, we knew we'd made an error, but right now, we needed that to understand the impact of that error. What are the effects to these patients, to these fragile, vulnerable babies?
We were quite confident that we had not caused any of our babies harm. We all took a great big sigh of relief, and we said, "Oh, thank goodness."
But then the follow-up, the disclosures, everything else we had to do, that evolved over several weeks and basically consumed the management team at that site and myself. I physically moved to that site for probably 2 weeks and reported to work there every day because it was a way to also show my support for the staff. We came up with a plan on what we would do to disclose to the families of these patients, and including a public disclosure as well.
Over a space, I would say, of about 2 to 3 days, we reached out and were able to contact the vast majority of the families. Well, very early on, Deb and I had a conversation about the staff. And Deb had been very concerned about them, as I was, that, and particularly in that 2 or 3 days where we were not sure what the outcome of the error had been for our babies.
We did our best to, number one, reassure the 2 employees who were involved that, we understood. We knew that they came to work to do the best work that day. There was no evidence of negligence, and we wanted to help them through it.
I took it upon myself with Deb to go down and meet with the staff and talk to them a little bit and reassure them about what had happened.
The support of a senior leader like Dr. Mader, he came down into the pharmacy and he spoke with the management team who'd been working tirelessly to gather all of this data, make the improvements and do disclosures and everything, and really gave them a lot of affirmation for their work. He also met with the two individuals directly involved in the error.
You're not in the healthcare business if you haven't had something happen that in retrospect you say, if I had done something different, that might not have happened. And I know from personal experience how devastating that can be.
So one of the things we thought we absolutely have to look at is the system. And really the light bulb went on for me. When I looked at that recipe sheet, I realized right then and there what was wrong. The problem was the way it was designed and the way it was constructed. It would be very easy for anyone else to make that particular, or to make an error. We wanted to have the staff as part of the systems review. And certainly a systems analysis methodology, or SAM, really encourages that as well. Also, they were the people who were there. They're the people who can tell you about what happened that day when they were preparing that product, doing the calculation, because very often there's also other contributing factors and environmental factors that we may not really be cognizant of without their input. By using human factors input, using the quality consultant, we were able to redesign that recipe sheet and to remove the areas that would make you error prone. Well, I think when it comes to a just culture, I don't think that it's something that you can say, okay, great, we'll be just, when we have this error, and we'll do a good job, and that's that. I think it's something you have to foster as part of your leadership philosophy, your management philosophy, and basically how you interact on a daily basis. When people bring you issues, people bring you problems, how can you foster that learning, listening, and understanding?